Hello, everyone. Welcome back. This is Lynn with Little Learner Printables. I hope that you have been enjoying my presentation so far on early childhood development. My channel is still new, and I am looking forward to sharing a wide range of topics with you designed to support parents, teachers, child care providers, and anyone else who cares about helping young children thrive. If you find these presentations helpful, please take a moment to like, subscribe, and share so you will be notified whenever new content is released. My current series focuses on social and emotional development. I am currently discussing the important topic of bullying, which is directly connected to social, emotional, and self-regulation skills. In part one of this series, I explored the child who is engaging in bullying behavior, including possible causes, warning signs, and ways adults can provide support and intervention. In today's presentation, part two, I will focus on the child who is experiencing bullying. We will discuss the impact that bullying can have on a child's emotional well-being, the warning signs adults should be aware of, and practical ways that parents, teachers, and caregivers can help protect, support, and empower children who are being bullied. So let's get started. Okay, part two, the child experiencing bullying. Today's topics will include warning signs a child may be experiencing bullying, what are the risk factors for the child that is being bullied, 10 common risk factors for children who are bullied, protective factors that help prevent bullying victimization, how to help the child that is being bullied, activities that help children that are experiencing bullying, and lastly, a few storybooks about bullying, kindness, friendship, and inclusion. Let's take a look at the warning signs a child may be experiencing bullying next. Let's take a look at warning signs. Emotional signs include anxiety, sadness, mood changes, irritability, increased crying, low self-esteem, and fearfulness. Physical signs would include unexplained injuries, frequent headaches or stomach aches, torn clothing, and missing belongings. Academic signs include declining grades, difficulty concentrating, avoiding participation, and school refusal. Lastly, behavioral signs. This would include avoiding school or activities, changes in eating or sleeping, clinging behavior, sudden aggression, social withdrawal, and loss of interest in favorite activities. So what are the risk factors for the child that is being bullied? Children who are bullied are never responsible for another person's harmful behavior. However, certain developmental, emotional, social, physical, or environmental factors can increase a child's vulnerability to becoming a target of bullying. Recognizing these risk factors helps adults provide protection, support, skill building, and intervention early. 10 common risk factors. Number 1, difficulty with social skills. Children who struggle socially are often more vulnerable. The behaviors to look for here include difficulty making friends, trouble joining play appropriately, social awkwardness, limited conversational skills, difficulty reading social cues, appearing unsure in peer situations, preferring to play alone often, and trouble maintaining friendships. Children who appear isolated are sometimes targeted because they lack peer protection. Number 2, shyness or social withdrawal. Quiet or timid children may be viewed as easier targets. The behaviors to look for here include avoiding group activities, speaking very softly, reluctance to participate, fearfulness around peers, clinging to adults, hesitation to stand up for themselves, avoiding eye contact, and appearing anxious in social situations. Number 3, low self-confidence. Children with low self-esteem may struggle to respond assertively. The behaviors to look for here include negative self-talk, frequently apologizing, seeking constant reassurance, difficulty making decisions, allowing others to control play, appearing emotionally defeated easily, and giving up quickly during conflict. Bullies sometimes target children they believe will not defend themselves. Number 4, emotional sensitivity. Children who react strongly emotionally may unintentionally reinforce bullying behaviors. Behaviors to look for here include crying easily, strong emotional reactions, becoming visibly upset quickly, difficulty calming down, anxiety around peer interactions, and fear of criticism or teasing. Sometimes bullies continue behaviors because they receive a noticeable emotional reaction. Number 5, differences that make the child stand out. Children perceived as different are often at increased risk. Possible factors include speech or language delays, learning disabilities, autism spectrum differences, ADHD, physical disabilities, medical conditions, cultural or language differences, clothing or economic differences, advanced academic abilities, and unique interests or behaviors. Children may target peers they see as outside the group norm. Number 6, lack of peer support or friendships. Children without close friendships are more vulnerable. Behaviors to look out for are frequently alone during free play, excluded from games, no regular play partner, others avoiding interaction, difficulty keeping friendships, and being left out intentionally. Strong friendships are one of the biggest protective factors against bullying. Number 7, passive or non-assertive behavior. Some children struggle to communicate boundaries. Behaviors to look for here include not saying stop, giving in quickly, avoiding conflict at all cost, allowing peers to take their belongings, appearing fearful during disagreements, and looking to adults immediately instead of attempting problem solving. Assertiveness is a teachable skill. Number 8, family stress or trauma. Children under stress may appear emotionally vulnerable. The risk factors here include divorce or separation, loss of a loved one, housing instability, abuse or neglect, chronic family conflict, and the behaviors to look for include anxiety, emotional withdrawal, hypervigilance, low confidence, and difficulty trusting peers. Number 9, overprotective or limited independence experiences. Children who have limited opportunities to solve social problems independently may struggle with peer conflict. Behaviors to look for here are reliance on adults in minor conflicts, fear of making mistakes, limited confidence in social situations, and difficulty advocating for themselves. Children need guided opportunities to practice social problem solving. Number 10, physical characteristics or developmental differences. Children are sometimes targeted because of visible differences. Examples here are height or body size, weight differences, glasses, dental differences, physical coordination challenges, clothing differences, and delayed motor skills. Unfortunately, children who visibly stand out may attract negative attention from peers lacking empathy. Children are less vulnerable when they have strong relationships with caring adults, at least one close friendship, emotional regulation skills, assertiveness skills, opportunities to build confidence, positive self-esteem, supportive school environments, adults who intervene quickly, and social and emotional learning instruction. Remember, in preschool and early childhood settings, peer conflict is developmentally normal or common, and not all conflict is bullying. Young children are still learning how to share, they're learning empathy, emotional regulation, impulse control, communication, turn taking, and friendship skills. However, repeated intentional aggression, exclusion, intimidation, or targeting should always be addressed early with supportive intervention and skill building. Today, I would like to discuss an important medical condition that is very close to my heart, but is often misunderstood and rarely talked about: Tourette's syndrome. This condition can affect young children in early childhood programs as well as those in early elementary grades. Although Tourette syndrome is considered relatively rare, many children live with this condition and may go undiagnosed or be misdiagnosed. As a result, some children are incorrectly labeled as defiant, disruptive, or intentionally misbehaving when their behaviors are symptoms of a neurological disorder. It is extremely important for parents and educators to seek guidance from a qualified medical professional who specializes in Tourette syndrome to ensure children receive an accurate diagnosis, appropriate support, and understanding. Tourette syndrome, also known as TS, is a complex neurological disorder typically beginning in childhood that manifests through motor tics, involuntary movements, and vocal tics, involuntary sounds. Common motor tics include eye blinking, head jerking, shoulder shrugging, tapping feet on the floor, tapping of fingers on a table or desk, while vocal tics may involve throat clearing, sniffing, or even the utterance of words or phrases. The condition often begins in childhood, with symptoms typically appearing between the ages of 5 and 10, though some children have been diagnosed as early as age 3, and this affects males more than females. Symptoms. Tics. Tics can be classified as simple, involving a few muscle groups, or complex, involving coordinated movements. They can vary in frequency, intensity, and type over time. Premonitory urges. Many individuals experience a premonitory urge, which is an uncomfortable sensation that precedes the tic, creating a strong desire to perform the tic to relieve the sensation. Associated conditions. Though not always, TS often co-occurs with other disorders such as ADHD and OCD, which can complicate diagnosis and treatment. Causes and risk factors. The exact cause of Tourette syndrome is not fully understood, but it is believed to involve a combination of genetic and environmental factors. Neurotransmitters in the brain, such as dopamine and serotonin, may play a role in the development of tics. I'm reminded of a movie that I highly recommend you see called Front of the Class, which tells the inspiring true story of Brad Cohen, a boy with Tourette syndrome. This film is based on Cohen's real-life experiences and his journey to become a teacher despite the challenges posed by his condition. Risk factors include family history. A family history of TS or other tic disorders increases the likelihood of developing the condition. Males are 3 to 4 times more likely to be diagnosed with TS than females. Diagnosis and treatment. Diagnosing Tourette syndrome typically involves a clinical evaluation based on the history of tics and their impact on daily life. This is why it is critical to seek out a medical professional that specializes in TS. Most children with TS are not treated with medication unless TS symptoms are severe. In addition, tics can vary in type, frequency, and severity, worsen if you're ill, stressed, anxious, tired, or excited, occur during sleep, change over time, and worsen in the early teenage years, and improve during the transition into adulthood. Let's look at treatment options. Behavioral therapy. Behavioral interventions such as comprehensive behavioral intervention for tics are often the first line of treatment, but remember, children with TS do not have control over tics. Medications. In cases where tics are severe and interfere with daily functioning, medications may be prescribed to help manage the symptoms. When it comes to living with Tourette syndrome, while there is no cure for TS, many individuals lead healthy and productive lives. Awareness and education about the condition can help reduce the stigma and improve support for those affected. Understanding that tics often diminish in severity during late adolescence can provide hope for individuals and families dealing with TS. You can read more information on this medical condition at Mayo Clinic and Johns Hopkins Hospital. Teachers, if you have a child in your classroom with TS, it is important to help the other children develop age-appropriate understanding of the condition. Children should be taught that everyone is unique and that some people may move, speak, or behave differently because of a medical condition. Providing simple, factual information can help reduce confusion, prevent teasing, and promote empathy, kindness, and acceptance. Teaching children to respect and support all classmates, regardless of their differences, helps create a safe, inclusive, and caring learning environment. Because this is such a rare medical condition, I want to help teachers be able to explain Tourette syndromes to young children. So you would say to your children, friends, everyone is different in special ways. Some people wear glasses to help them see. Some people use wheelchairs to help them move. And some people have something called Tourette syndrome. Tourette syndrome is a medical condition that can make a person's body move or make sounds that they cannot always control. These movements or sounds are called tics. Just like you cannot stop a sneeze sometimes, children with Tourette syndrome cannot always stop their tics. They're not doing it on purpose, and they're not trying to be disruptive. They are still our friends, and they deserve kindness, respect, and understanding. So if you notice a tic, the best thing to do is continue playing, learning, and being a good friend. In our classroom, we treat everyone with kindness and respect because everyone belongs here. Helping and protecting a child who is being bullied requires both immediate protection and long-term emotional support. Children who experience bullying need adults who are calm, consistent, emotionally supportive, and proactive. The goal is not only to stop the bullying behavior, but also to help the child rebuild safety, confidence, emotional security, and healthy social skills. Number one, take the child seriously. One of the most important first steps is believing and validating the child. What children need to hear from you is, I'm glad you told me. This is not your fault. You do not deserve to be treated this way. I am going to help keep you safe, and you are not alone. Children often stop reporting bullying when adults dismiss, minimize, or blame them. Number two, ensure immediate safety. Adults must step in quickly and consistently. Protective actions include increase adult supervision and separate the child from the aggressor when necessary. Please monitor high-risk areas, playground, hallways, lunchroom, bus, bathrooms. Create a safe person or safe space the child can go. Develop a safety plan and document incidents carefully. Children should never feel they must handle serious bullying alone. Number three, teach assertive communication skills. Children benefit from learning calm, confident responses. Helpful skills to practice include making eye contact, using a strong, calm voice saying, stop, I don't like that, that's not okay, leave me alone, walk away confidently, and getting adult help appropriately. Role-playing these situations can increase confidence. Number four, strengthen friendships and peer connections. Having even one supportive friend greatly reduces bullying vulnerability. Ways to support peer relationships are arrange playdates, encourage clubs or activities, pair the child with kind peers, practice friendship skills, teach conversation starters, and encourage cooperative activities. Children with social support are less likely to be targeted repeatedly. Number five, build emotional resilience and confidence. Bullying can damage self-esteem and emotional security. Confidence building strategies would include praise strengths and efforts, encourage hobbies and interests, provide opportunities for success, teach positive self-talk, celebrate the small accomplishments, help the child identify their strengths, and encourage independence and problem solving. Children need reminders that bullying does not define their worth. Number six, teach emotional regulation skills. Children need the tools for handling fear, sadness, anger, and anxiety. Some of the things that you can help them with is helpful coping skills, deep breathing, calm down strategies, identifying emotions, journaling or drawing their feelings, relaxation exercises, talking to trusted adults, and practicing calming routines. These skills are helping children feel more emotionally secure and in control. Number 7, work closely with the school or child care program. Bullying interventions work best when adults communicate consistently. So it is important to discuss important steps, report concerns early, ask about supervision plans, request documentation of incidents, maintain regular communication, ask how social and emotional skills are being taught, ensure consequences are consistent, and advocate for the child's safety needs. The focus should remain on safety and solutions rather than blame. Number 9, avoid harmful responses. Some common advice can unintentionally worsen the situation. Avoid saying things like just ignore it, fight back, toughen up, you need to stand up for yourself, and kids will be kids. These responses can increase shame or make the child feel unsupported. Number 8, monitor for emotional or mental health effects. Bullying can deeply affect emotional development. Warning signs to watch for are anxiety, depression, sleep problems, school refusal, withdrawal, declining grades, frequent physical complaints, loss of confidence, self harm statements, and aggression or emotional outburst. Professional counseling may be helpful if the symptoms persist. Number 10, teach the difference between reporting and tattling. Children need to know when adult help is appropriate. Explain that reporting is keeping someone safe, preventing harm, asking for protection, and solving serious problems. Children should never feel ashamed for asking or seeking help. Number 11, model healthy relationships and conflict resolution. Children learn from adult behavior, so adults should model respectful communication, emotional regulation, empathy, calm problem solving, healthy boundaries, and kindness and inclusion. Children do observe how adults handle conflict and relationships. Number 12, help the child regain a sense of control. Bullying often makes children feel powerless. Ways to restore control include involve the child in safety planning, give choices when possible, practice problem solving together, encourage self advocacy, and help them identify trusted adults. Empowerment is an important part of healing. Children will recover best when they have loving and responsive adults, safe environments, strong peer connections, emotional support, consistent routines, opportunities for success, adults who advocate for them, and social and emotional skill instruction. A caring adult who consistently listens, protects, and supports a child can make a tremendous difference in long term emotional well being. When preschool children or older are experiencing bullying, exclusion, teasing, or aggressive peer behavior, activities should be focused on helping them build confidence, emotional expression, problem solving skills, safety awareness, friendship skills, and resilience. Young children learn best through play, stories, role playing, and hands on experiences. Now let's look at activities that help children experiencing bullying. You should also include the child that is bullying other children. This gives them the opportunity to learn how others feel and teaching them social emotional skills. Let's look at feelings and emotion activities. These activities help children identify and express emotions safely. Number 1, emotion matching cards. Match the faces with feelings such as sad, scared, angry, worried, brave, and happy. Number 2, how would you feel? Circle time. Show children social situation pictures and ask, how would this child feel? What could we do to help? Number 3, feelings puppet play and also dramatic play area. Children use puppets to act out friendship problems and solutions. As I've said many times in previous presentations, children absolutely love dramatic play and puppet theaters. Number 4, emotion drawing journals. Children draw a picture of something that made them feel sad, happy, or brave. Number 5, friendship and kindness activities. Friendship trees. Children add paper leaves with kind actions written or drawn on them. Compliment circle. Each child says one kind thing about another child. Buddy activities. Pair children together to complete puzzles, art projects, or building activities cooperatively. Kindness bucket. Children place kindness notes or drawings into a classroom bucket whenever they notice kind behavior. Number 6, cooperative play activities. Children work together using blocks, magnetic tiles, and large floor puzzles. Group art projects. Children share materials and create one large picture together. And team obstacle courses. Encourage teamwork rather than competition. Number 7, confidence building activities. I am special posters. Children create posters showing things they are good at, things they enjoy, and positive qualities about themselves. Brave voice practice. Practice using strong, respectful statements. Please stop. I don't like that. That hurts my feelings. I'm going to tell the teacher. Role play practice. Practice safe responses through pretend play. Walk away. Getting help from an adult. Using assertive words, including others in play. And finally, number 8, social emotional skill activities. Problem solving cards. Show situations such as someone won't let you play, someone called you a name, a child grabbed your toy. Then discuss what happened, how did the child feel, what could they do. Lastly, calm down area. Provide children with sensory bottles, soft toys, calm down cards, and breathing visuals. This teaches emotional regulation when children feel overwhelmed. Now let's look at some preschool storybooks about bullying, kindness, friendship, and inclusion. Llama Llama and the Bully Goat. This story is about Gilroy the goat teases and bothers the other children at school. Llama Llama learns to walk away, tell an adult, and handle the situation appropriately. Skills this book teaches is reporting bullying to trusted adults, emotional regulation, friendship skills, conflict resolution, and safety skills. The Pout Pout Fish and the Bully Shark. This story is about a shark behaves unkindly toward others, and Pout Pout Fish helps teach friendship and kindness. Skills this book teaches is friendship, kindness, respect, social interaction, and emotional understanding. The Juice Box Bully. This story is about a new child enters the classroom and begins treating other children poorly. The class learns they all have a responsibility to stand up for kindness and help create a safe classroom community. Skills this book teaches is standing up to bullying, being an upstander, classroom cooperation, respect for others, problem solving, and community responsibility. And finally, in my next presentation, Bullying, Part 3, I will focus on immediate steps to take if a child becomes physically aggressive in a child care setting, immediate steps for the child who was bullied or hurt, immediate steps if a child becomes physically aggressive at home toward a sibling or adult, best ways to hold a child who bullies accountable for their actions, and the most effective accountability. In my presentation, Bullying Part 4, I will focus on how to approach and help the child who is bullying and when to involve law enforcement. I hope this information has provided you with a deeper understanding of why some children engage in bullying behaviors, the challenges and struggles they may be experiencing, and the needs of children who are being bullied that require guidance, intervention, protection, and support. While it is important to understand the underlying factors that contribute to bullying behavior, this understanding should never be mistaken for an excuse. Children must still be held accountable for their actions. Accountability is a vital part of helping children develop empathy, responsibility, self-control, and respectful ways to interact with others. My goal is to help you become a more informed parent, teacher, or child care provider by equipping you with the knowledge and tools needed to support children's growth and development. Together, we can help children learn, practice, master, and thrive in the skills they need not only for success in school, but for success throughout life. Remember, the most formative years of development occur between the ages of birth and 6. This critical window lays the foundation for children's social, emotional, cognitive, language, and physical development. You have the power to make a difference in a child's life. Happy teaching.